Good morning, everyone. My name is Robert Hersey. Happy Thursday to each of you. And on behalf of FATA, welcome to today's webinar titled Behind the Buzz: Trends, Risks, and Prevention Strategies to Address Alcohol Use Among College-Aged Adults. This webinar is being made available through a collaboration between the Florida Department of Children and Families and FATA. Please note that as an attendee, you are in listen-only mode and are only able to view your name. Your webcam and microphone have been disabled. If you have questions, please send them to us using the chat panel. We will answer questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio at any time during today's presentation, there are a few options to try using the audio connection panel. For computer audio, click the up arrow next to Audio Settings, click Leave Computer Audio, click Join Audio, click Join with Computer Audio, and follow the instructions. If you experience poor audio through your computer, try calling into the presentation. Instructions are on your screen and will be posted in the chat panel. You must be connected to the audio of this presentation as well as view it on screen to receive a certificate. We cannot verify attendance if you are not connected to Zoom through the website, desktop application, or mobile application. Therefore, call-in only attendees are not eligible for a certificate of attendance or CEUs. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording and PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. A certificate of attendance and CEUs for up to 2 continuing education credits are available for participating in today's webinar. CEUs are available for individuals licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, Mental Health Counseling, and for those credentialed through the Florida Certification Board. To receive a certificate in CEUs, you must attend the entire webinar. Zoom provides a report of the arrival and departure times of attendees. We are not permitted to provide partial credit. Also, complete the post-webinar evaluation. The evaluation will close on February 3rd, 2026. Certificates will be distributed within 30 business days after the evaluation closes. CEUs will be reported to CE Broker within the same time frame. FATA has implemented operational changes to our webinars based on the feedback of our attendees. Below are a few important changes. Evaluations will now take place in Zoom immediately after the webinar. Certificates will now be emailed to you directly. You no longer need to sign into your FATA account to complete evaluations. For all webinars and workshops November 2025 and later, certificates will be emailed to you directly. For all webinars and workshops before November 2025, certificates are still accessible through your FATA account. This presentation is intended solely for educational purposes. The views, opinions, information, and content expressed in the presentation are those of the presenters and do not necessarily reflect the views, opinions, or policies of the state of Florida, the Florida Department of Children and Families, FATA, or the Florida Behavioral Health Association. Attendees should note that sessions are recorded and published in various media. Our presenters today will be Vanessa and Maria. Vanessa is a dedicated public health professional with 10 years of experience in quality improvement, health promotion, public health marketing, and research in epidemiology. She has worked at the local and federal level within government and nonprofit sectors. Currently, she is the Epidemiology and Evaluation Director at Community Coalition Alliance, where she coordinates data collection and reporting to track overdose and mental health trends to guide strategic prevention planning for coalition development. Vanessa is also an adjunct professor for public health courses at the University of North Florida. Maria began her public health journey in 2015 at Daytona State College. She earned her Master of Public Health with a concentration in epidemiology from the University of North Florida in 2020, along with a graduate certificate in global health. Maria continues to serve the University of North Florida as an instructor in the Bachelor of Science in Health program and as a faculty advisor for the National Health Education Honorary, UNF Alpha Gamma Chapter, She actively engages students in prevention-focused research and community-based service learning projects through partnerships and local agencies. And now I will turn it over to our first presenter, Vanessa. Vanessa, you have the floor.
Thank you so much, Robert, and thank you, Maria, for being here today with me. I'm really excited that all of you are joining us today and that we're going to be able to share with you some trends, risk, and prevention strategies to address alcohol use among college-age students. First, I just want to share a little bit more about CCA, or Community Coalition Alliance. Our mission is to serve as a collective voice of community coalitions working toward the health and wellness of all Floridians. On the screen, you can see our vision, mission, and our values, and some of the goals that we have for our agency. CCA was established in 2008, and we have over 16 years of experience in providing oversight and monitoring through funding opportunities, as well as supporting community-based environmental strategies through through our partnerships with our local coalitions and members throughout our partnership throughout the state of Florida. We also provide training and technical assistance, and we use data-driven decision-making and evidence-based strategies to identify and address the risk and protective factors that we find with the health issues that we're addressing in our state. Through this, we aim to drive improvements in all of the health outcomes throughout for all of Floridians across our state. And our membership body includes some amazing partners. I saw some of them are in this call today. And we're really lucky to be able to partner with amazing coalitions throughout the Northeast Florida region, various partners, and also some coalitions also in our Southeast region as well. So if you're interested in connecting with any of the agencies listed on the screen, or you're looking to build a coalition, go ahead and reach out to CCA. We'd love to support you with that. During today's call, we're going to be covering, oops. Okay, there we go. During today's call, these are our learning objectives for today. We're going to understand who college age individuals are, as well as their influences, understand some of the drinking habits among college age individuals, and some of the impacts of those behaviors. We also are going to look at community and campus efforts to prevent and intervene in the college age space. To accomplish our learning objectives for today, this is our agenda. And we're going to start by, talking about who college age individuals are. We're going to go over some behavioral data, look at those influencing risk and protective factors, and talk about those efforts. So first, I want to kind of set the stage for who exactly we're talking about. Our priority population for today is going to be our traditional college students, but I just want to kind of make that designation between traditional and non-traditional college students. So for traditional students, we're looking at people who are aged 18 to 24. Usually they enroll immediately after high school. Typically they're full-time students and are often also living on campus. Those are some of the key characteristics of traditional college students. On the other hand, we also have non-traditional college students, equally as great. Those individuals might be 25 years or older, often maybe delayed college enrollment, or might be attending part-time as well. Usually these individuals are living off campus and they may identify as career changers or maybe career advancers. Maybe they're going back to school, to advance their career. They might even be identifying as parents or veterans, a couple of those, adjectives we might use to describe non-traditional college students. But for the focus of today's presentation, I just want to set the stage that we're going to be focusing our data and a lot of our, risk and protective factors, as well as some of our programs and, those resources and things on the traditional college students. So when we're chatting about the trends, just think about it in terms of those 18 to 24-year-olds who are kind of those traditional students. And then to kind of, set the stage for some national level data, this is for spring of 2025. The enrollment in the nation is over 10 million college students age 18 to 24. We see that there's about a little over 6 million students who are 18 to 20 and around 4 million students who are 21 to 24 in the nation. So just kind of, setting the stage for how many traditional college students we have. And then within our state, we have over 1 million students enrolled in all of our Florida colleges throughout the state, and around 60% of them are ages 18 to 24. You can see some other demographics on the slide as well, so I'll give you a chance to look over those. And I want to let you guys know that this age is actually Generation Z. So we're going to kind of talk through some of the characteristics of Gen Z populations so that we kind of can understand some of the key characteristics that are influencing these individuals from a variety of sources like media, their social support systems, and things like that. So Gen Z is accounting for around 20% of all Americans. They are born between 1997 and 2012. They are also the most recorded age group in college today. I mentioned they're around, 60% of college students. Um, and they are kind of in between millennials and Gen Alpha. So Gen Alpha is our newest generation of individuals. They're kind of like our middle school, early high school individuals. And then millennials are a little bit older. Maybe our non-traditional college students are falling into that millennials generation. And again, so about 20% of Americans are in Gen Z. One out of every five Americans is a part of this generation. And this group of individuals primarily looks for information from YouTube, compared to credible sources, right? So they're, looking on social media, looking on YouTube for information, kind of fast information, maybe scrolling social media, maybe they're following news, stations, but maybe through social media versus watching the news on the television and things like that. So they're getting their information from different places. So we also have to think about this when we're communicating about how to change their health behavior. So kind of just setting the stage for where they're getting information and how we can, later on, we'll talk about how we can leverage some of these platforms to communicate and educate this college age population. They also are heavily influenced by technology, social and geopolitical landscapes. They care a lot about diversity and, they're also influenced by their parents, but they also have an autonomy that is a little different than some of the other generations. And we'll kind of chat through that a little bit more. But this generation does often have a desire to have the other people they're working with earn respect rather than maybe just given, which is a difference than some of our other older generations where they, give respect because of somebody being an elder versus wanting that person to maybe, earn that trust and things. So just, a little bit of some different characteristics about Gen Z. We also find that this group of people have also experienced pandemic related disruptions to their education. Potentially, they were in high school and went virtual for a while. Potentially, were distance learning if they, were maybe considering even enrolling in college. They might have delayed it because of COVID potentially. I even have my own students have shared their personal lived experience of some of them have like had 2 years of college before COVID. Some of them had, a year or two where COVID was happening. So it was like a little bit intense for them where they were talking about having returning to campus, where they felt a lot of social anxiety of returning to campus after those like extended closures and extended time of distance learning. And then returning to that classroom setting where there's that in-person interaction. I've had some students, come to me and chat with me about that experience that they had. They've also kind of had like a career false start sometimes, potentially, where, maybe they were thinking that they would have this in-office environment and potentially they didn't, or, maybe career delays, potentially longer periods of time in college, or, maybe even just the isolation has, impacted them. And of course, socially as well. So just kind of a few things that they experienced that maybe other generations potentially haven't experienced early on in their education and their careers. So in terms of social and emotional health related to Gen Z populations, we do see that they spend more than 4 hours a day on our apps, like, social media apps. It might be other apps on their phone, potentially even using their phone heavily for work and for school. I've had, a lot of my students, they, have iPads, laptops, phones, and they're continuously connected to school, work, kind of never really sort of shutting off. They feel like they have to be on 24 hours a day because it's continuous access to information and technology and things. Um, Even during distance learning and self-paced classes, it can be difficult to disconnect. You're not going into an office 9 to 5 and leaving per se, so it's a little bit different of an experience as well. So, kind of that 24 hours a day being on is kind of what they've shared anecdotally. Also, they focus more on the bigger picture, so kind of thinking long term or bigger picture in terms of instead of maybe thinking like baby steps and things, they think um, more big picture. And then we also found that 47% of them identify with having a mental health challenge. They may or may not have been diagnosed with a mental health challenge. Some of the data does show when you're trying to gain access to mental health resources, there's often an 8 to 11 year delay between onset of symptoms of mental health and accessing adequate treatment or accessing adequate credible resources. So we're going to show you some great resources for you guys today to hopefully intervene sooner for these populations related to their mental health. And so, a little bit more research on Gen Z, we do find that they're describing themselves as ambitious, money savvy, socially aware compared to some other generations. They really care about the products that they purchase and want them to have like a positive and social and environmental aspect. Um, I would say that later on in this presentation, we'll show some photos. There's some very interesting products on the market that are communicating to sort of this socially aware and environmentally impactful generation. So some different types of products on the market. They also are kind of less willing to accept stereotypes. So they're when I mentioned about like respect and building trust, they look for cues in order to build those things, right? Versus just automatically like assuming something about somebody or assuming something about a product or they literally are researching and trying to learn for themselves versus trusting somebody else's opinion or trusting that giving trust right away sort of there it's more of like an earned based characteristic, I would say. And then I also want to mention a little bit more about the brands. So this generation was born social, same with some of our millennial generations. Computers, internet has been in existence since they were born. A lot of them already have a digital footprint. Of course, these individuals are young adults, right? But even our Gen Alpha, which is our next, Gen Beta, Gen Alpha, these individuals also already have a digital footprint. So kind of starting with Gen Z is really first generation that kind of was born creating this digital footprint. And so we have to think about that in terms of when we're communicating to this population. And companies are really focusing on aligning their brands with, certain causes that matter to Gen Z. We saw a lot of, brands kind of change their messaging during COVID. Little marketing signs changing, even today, like kind of playing into this different things that Gen Z really cares about. They also are marketing on those platforms, those apps, the websites, YouTube, all these places where Gen Z are already showing up and are commonly, engaging on a daily basis. They're collaborating with these influencers that are really aligning with the Gen Z population. We know that when peers talk to peers, that message is usually more effective, and alcohol brands know that. We'll show some interesting studies that we did where we did some environmental scans later today. So I just want to kind of talk about some key influences that are, impacting this generation, um, including, including strong beliefs that communities should play a central role in tackling the world's problems. They want to get involved. They really care about getting involved. They want to give back to the world. Gen Z also wants to have an influence. They want to be inspired by real people. I mentioned peers talking to peers, and they care that experts can deliver a trusted message. So, I think it's really cool that we're going to be sharing a credible mental health platform with you later today. I think this is a great opportunity for communicating to our Gen Z population about health and well-being. And then they also have, an interesting communication style. It's best to communicate to them in concise conversational languages with visuals that have multiple images, for example, or, in a video that is like continuously transitioning to the next image. So, I've had some conversations with some of my colleagues and their children, and, just kind of seeing the memes that they send. And I know it's kind of funny to talk about it, but this is kind of how they're communicating. They're sending reels, they're, sharing content on social media with their friends, with their parents, with their grandparents, even potentially, right? And the reels that are, being shown to Gen Z populations are different than the reels that are even being shown to millennials, boomer generations, I mean, all of these different generations, they have just different types of messages on social media. And if we're not aware of that, because our algorithm is going to be aligned to our own communication, right? So we might not even see on social media if we are even researching what Gen Z is seeing. So just kind of noticing that, even the videos that are being shared are continuously moving to the next frame. It's like 3-second frames, basically. So just kind of thinking, even as you're developing communication messaging, that's a key driver of getting Gen Z to listen to the message. Again, the text format is concise, small. You know, even sometimes the captions are in the comments. So if the caption is very long, putting half of it into the comment section, just little tips and tricks on the marketing aspect of those things. So, but we do care that um, they also really do value in-person communication. We're kind of getting to the next generation that may or may not like to do in-person communication. And some generations they don't like to call. So we're kind of like on this edge of, in-person communication can be a really key driver to Gen Z uptaking certain health behaviors. But it's really important that when we are communicating with them, we're, being inclusive. We're also being very transparent. If we don't know something, we tell them we don't know. We'll find out the right answer, versus, just kind of being that perfect all around expert, which probably none of us are, right? We know a lot. We're all subject matter experts, but there's probably something Gen Z can teach us as well. And that constant feedback. They want to make sure that their feedback for us is also, an open door both ways. So it's just some common characteristics about their communication style. And then I think I'm going to turn it over to Maria now. Um, thank you, Maria. And thanks, guys, for letting me intro the presentation today.
Thank you, Vanessa. I think that's all great information, just really starting to get to know this population, who those college students are, the traditional ones, their different communication styles. And as this webinar is on alcohol use, so just thinking about why we need to be talking about that. And just as a reminder too, so I work full-time at the University of North Florida with our students. I'm also on our Healthy Osprey Advisory Board. So we do a lot of campus prevention and efforts around this because we know that it's needed. So I'm really happy to be here to talk about this today as well. But this information comes from the National Institute on Alcohol Abuse and Alcoholism. It was a report they released in 2025. And some of the key reasons they talked about needing to talk about college student alcohol use was that it's a major public health concern. It leads to a lot of deaths, a lot of car crashes, and also sexual assaults on campus. So we know that it is kind of intertwined with all of these other things happening among this population. We also find students who do engage in alcohol use tend to have worse academic outcomes. They can have those longer term health risks, especially if it's not something that they're able to get a hold of during college and it proceeds into their professional life. And then also that secondhand harm to others. So just thinking about if they are getting behind the wheel or anything happening like that. So we do need to talk about it because it's a real issue and it's very available to students, especially on campus. A lot of campuses actually have bars or places close by where students are easily able to access alcohol, and then also tailgating and all of those different areas where we see it being used. So when we think about the data behind this, this data comes from the National Survey on Drug Use and Health, and this was 2023 to 2024. So a little older. We will get to look at some spring 2025 data in just a little bit, but this comes from our national survey. And thinking about past month alcohol use, we see about 50% of college students saying that they have engaged in alcohol use in the past month, with about 29% saying that they've engaged in binge drinking. And this is actually a little bit higher than just the typical young adult. So when we just look at 18 to 24 alone, we see about 26% engaging in binge drinking. And then with the college students, we're seeing about 29%. So it does change a little bit when they're in that social environment. Maybe the academic stress leads them to drink more, or just having the access again on campus. It is readily available for them to get in their dining settings. We also see for heavy alcohol use that about 7% of college students report drinking heavily, and then also 5% report high intensity drinking. And some consequences of this is we do see about 1,500 deaths among college students yearly that are related to alcohol-related incidents. And about 14% of college students currently meet the criteria for alcohol use disorder. So we are seeing slightly higher numbers, and it's nice to be able to compare it from just the typical young adult to a young adult who's also in college settings. And this is just alcohol use in the past month among adults aged 18 to 25 by state. So just trying to do a little comparison and thinking about that we do see more in the northern regions, more drinking, and then Florida is sitting at about 46 to 49% of adults age 18 to 25 reporting drinking behaviors. But again, when we look at the college students, we typically see those being higher. So that could be even closer to that 50% mark. So just a little comparison to the rest of the country and what we see in Florida. We definitely have a lot of colleges here, which could equate to having that higher rate. And with binge drinking in the past month by age group, just keeping in mind that the 18 and older is this little green bar here right under our highest orange bar, which is the 18 to 25. So 18 to 25, we're typically seeing the highest level of binge drinking in the past month since 2015. And then 18 and older just comes right under that. So again, that age range, it matches to our college population, but it also matches to those higher rates of alcohol use and also binge drinking in that population. This graph goes over perceptions of great risk of harm. So thinking the opposite of what we saw before is that this 18 to 25 age range, which is still that rusty orange color at the bottom there, actually has the lowest perception of risk for having 5 or more drinks of an alcoholic beverage once or twice a week. So when we think about this binge drinking behavior, also thinking about those perceptions, and some strategies we could think on are how can we change that perception so that they're more aware. Again, we'll get into it a little bit later, but we have something called like red zoning in the fall semesters where the dean of students comes out at UNF and they talk about what are called red zones. So they're high drinking areas where college students typically go that are also like high human trafficking areas. So it gets students really thinking about the overlap between some of these consequences or impacts when it comes to drinking as well. So they do a lot of work around that in the fall, especially as students come to Florida. So we are a state where students want to go, like they want to come to the Sunshine State to go to school. There's a lot of great scholarships here. So we're also taking care of other states college students as well. Like these college age students are coming to Florida. So it's really something that we want to focus on keeping them safe for this 18 to 25 age range here as they're just becoming these independent adults, right? And then this data comes from the National American College Health Association data that's collected every spring semester. For this one, there were, for just this past spring, 2025, there were 47,000 students who participated, and 96 schools were actually just gearing up. I had a meeting yesterday to do this again this spring. So this data comes out really frequently. So it's nice to be able to have that like real time data that's not 2, 3 years back. This just was last spring. So what they saw here was that about 64% of students in the US had reported that they ever used alcohol. And this is college. So when we talk about students, think college student. So that's actually higher than those numbers we saw in 2023 and 2024. So 50% now jumping to 64% in spring 2025. 40% of participants had reported drinking within the past 2 weeks. 41% reported drinking 3 to 6 drinks the last time they drank. So again, somewhere around that binge drinking range. And 11% actually said they had about 7+ drinks. So, again, that heavy drinking, thinking about their social drinkers, and there's a lot of places on campus, so they're able to walk to and from their dorms also, which could be increasing the amount that they feel they're able to drink. There's also reports that 30%, or about 1 in 3 college students, reporting weekly alcohol use, and then 8.2% reported that alcohol has actually led to health, social, or legal or financial problems for them. So that's about 1 in 10 students reporting this in spring 2025. And then 10% reported that someone had actually expressed to them concern about their alcohol use in the past. So those bystanders, a friend, mentioned to them, hey, I think that you might be having a problem. And maybe it was even a professor who recommended that they go to a counseling center. But about 10% had actually had somebody who was worried about them based on their drinking behaviors. And this data comes from the Healthy Mind Study. So just a little more, because we want to give you guys that good background. This looked at 84,000 students from across 135 colleges and universities. So a little bit higher of a sample. This was over a year time frame as opposed to just a semester. But at this point, thinking about their mental health, 27% of students had reported that they have moderate to severe depressive symptoms. So about 1 in 4 students, 1 in 3 students reporting anxiety, 11% reporting that they had seriously considered suicide in the past year, and 52%, so 1 in 2 students reporting high levels of loneliness. So again, even though they're in those social settings in college, we still see a lot of these depressive symptoms, loneliness, thoughts of suicide, and then that high anxiety. And just thinking that although these students are considered traditional, they're also, they've increased the limits on classes. So it used to be in order to get financial aid, you only had to take 4 classes. Now you have to take 5 minimum. They've made it a lot harder to get different support. So students are having to work multiple jobs. Campus housing can be limited because, again, students want to come to Florida and the colleges want to have these students come to their campuses. And so there can be lack of housing on campus for students. And all of those things could lead to some of these mental health concerns that we're seeing among our college student populations at this time. Other risk and protective factors include that they are under that peer pressure, so they want to be fun. College is their first time being independent. Maybe they're coming from out of state. They want to make friends. And if the fun things on campus always involve alcohol, which we hear a lot, is that there aren't a lot of opportunities to not engage in alcohol use in a social setting. Then we're starting to see that there is that peer pressure. Students want to fit in, they want to make friends. Also, stress and coping, again, they're overloaded to the max between working 2 to 3 jobs, taking I've heard students tell me they're taking 8 classes. When I was a college student, I had to sign a waiver if I was going to take over 4. Our advising office would not let us take over 4 classes without signing off that if we fail, it's on us. Now they're recommended to do 7 or 8 just based on wanting to move students through and get new students in. So there is a lot of stress going on, and the counseling centers are very overwhelmed with the amount of students and trying to keep that staff. So, creative ways that we can approach that as well. There's also the community norm. So in college, it's supposed to be fun. You're independent. You probably are going to turn 21. But also we see the underage drinking, and that's more common among college students as well, because again, that accessibility is there, and then they are integrated with all of these older students as well who are doing it. So there becomes this community norm. Tailgating's another community norm that we see where they all get together and they drink before a sports game. And then finally, that access piece, like we talked about, they do have access on the campus, near the campus. So there's a lot going on with that and availability of the alcohol to students. So, some knowledge gaps, other risk factors that we see is just, again, that low perception of harm. So, they don't really understand substance risks and harms at that point. They're, again, like 18 to 25. So, they're just kind of getting out into that independence, that social. So, they're not always thinking about the risks that come along with that as well. Addictiveness and long-term effects. It's fun in the moment. We see a lot of the data coming in from FISIS where, students are more concerned with the short term. And if we're thinking 18, the FISIS data can tell us a lot about who our college students are going to be. And so just seeing that, they're thinking more on the short term, they're a little more impulsive at that point. Brains are still developing. There's also that legal awareness and regulations, although they might have a little bit more of that, they're still learning again. And if they're on campus, they don't feel like they have to drive. Okay, maybe it's okay to drink more. So they might be doing some bargaining with themselves at that point. But things that we can do is raise that legal awareness and also about regulations on campus and in the community, impacting peers, the impact of peers in social media. So again, thinking peer pressure, they're trying to fit in, they want to have a good time, they want to post videos of them having fun so their family and friends can see they're having a good time. But then other students see that and they think, oh, okay, to fit in, I need to now be doing the same thing. Like these students are having a good time, I do too. And so if all they're seeing is that students who are having a good time are going out getting drinks, things like that, then it becomes this, again, community norm. The alcohol and substance co-use. So not only is alcohol available on campus, but there are other substances available to them as well. There's a lot of prescription sharing and things like that that we try to combat. So again, back to that legal awareness and regulations, just making sure that they understand the repercussions of those things. Because we see a lot of students who get prescribed Adderall, things like that, and then they share them. If they don't realize that is an immediate felony, that student could ruin their lives, right? And they're in college to do better and to move forward. So we want to make sure that they understand that, those legal awarenesses, and that they also understand that it's just dangerous. I've done a lot of presentations for sorority fraternity life on this because they're always looking for faculty to come out and talk about the different risks. And it's just that co-use, like it's so easy when you're under the influence to just trust the person. But just being really careful about that. And our police department's really big on making sure students are aware of those dangers as well. And then also the dangers of new and emerging substances. So making sure that we are sharing that information with students too, so that they know and they can stay safe out in their communities. So there are some questions that we want to make sure to answer. And so Vanessa and I are going to continue to go answer some of these questions as we go through. But number one, where are college students getting their information? Where are they getting the idea of using alcohol, and where is it being reinforced in their lives? Who are their audiences? So any secondary, tertiary individuals that we can train to work with them. So I would be considered a mandatory reporter at the university as an instructor. Anybody who works on campus would be a mandatory reporter for that. So if we're trained to recognize the signs, then we can do a better job of helping students and referring them out. And then also thinking about their environments. What are they seeing? What do they have access to where they live, work, and play? So these are some things that we're going to continue diving into as we go through the rest of our presentation today. And at this time, I'll turn it back over to Vanessa.
Awesome. So now I'm going to talk a little bit more about the environment and what we're seeing boots on the ground across the state of Florida. Um, in 2025, CCA, in partnership with our local coalitions and our partners, the National Guard and other, partners throughout the state, we conducted the SINAR coverage study, which is a national initiative to conduct unannounced random inspections of tobacco retailers that takes place every 5 years. CCA is leading this initiative for the state of Florida, and we did inspect establishments for other types of substances other than tobacco, such as alcohol and much more, that we'll share here. But just wanted to kind of, set the stage for what we're going to cover here. This is an initiative to do environmental scans, is what we call it. We go out to the establishments, all these different businesses. I'll show you which types of businesses we visited in a moment. And we're really just scanning to look, for various types of substances. I'll show you like exactly kind of what we're looking for. Again, we did a random sample of 25 different census tracts across the state of Florida that actually ended up being in numerous counties across the state. Nearly 25. We had a couple of duplicate census codes randomly chosen, but we did get a very robust sample size. We visited over 900 stores in the state of Florida. I believe, if off the top of my head, it's 934 stores. And again, that was a random selection of all tobacco retailers, alcohol retailers, anybody with these types of permits in the state of Florida. And then we also went to other establishments that I'll show you. We were looking for four key contributing factors or community risk factors. These things include, the types of products themselves that are being sold, where those products are placed. For example, if they're below 3 feet, we view this as being more potentially attractive to youth. Youth are a little bit shorter. I know that we're kind of talking 18 to 24-year-olds, so those are young adults. It may or may not apply, to them, but we're going to think about youth and how we can prevent youth use even younger. So then that way, maybe that mindset is that the perception of risk, as Maria mentioned earlier, will increase. So that later on, when they are 18 to 24, maybe they will have such a perception that it is risky to binge drink and, all these things that they won't choose to binge drink. And then also the other things we're looking for include product marketing practices, like the promotion. We also want to know the pricing of things, and other, other things like that. So I'll elaborate on some of these four key points in a moment. The places that we visited include bars. We went, to different events. Sometimes you have to pull a permit to do like a catering event if you're including alcohol. Gas stations, convenience stores, liquor stores, restaurants, other retail stores like small convenience stores, corner stores, pharmacies as well, smoke shops and vape shops, and anything else that we had a permit for tobacco, alcohol, or any other substance. And then these were the substances that were actually sold. We found, so across the study of 934 stores, 66% of the stores were selling alcohol. Again, we did survey for other additional types of substances to kind of ensure a robust understanding of the availability of substances across our state of Florida. We found around 62% sold tobacco, lots of vaping products, around 40%. We also found Delta THC products, CBD products, kava, kratom, mushrooms, and inhalants. Although those are not the key topics of discussion for today, one thing I will just mention is that some of these products are being sold in drinkable form. Although we are focusing on alcohol today, a key driver of some of our risk perceptions that we need to start communicating are combating the brand messaging, which is stating that some of these other products like, THC drinks, kava drinks, kratom drinks, mushroom drinks, they're being marketed as less or more healthy, sorry, they're like less risky, right, than alcohol. So these brands are communicating to young people saying, we don't want you to drink alcohol, we want you to be safe, we want you to be healthy, here's another alternative. But that is still considered like a driving while intoxicated. Maybe young people may not realize this. So we have to still communicate some of these risks to these individuals. So I just wanted to make sure that you guys are kind of aware of some of the other substances that we found boots on the ground across the state of Florida. These things were found in a variety of formats. I will maybe drop in the chat later, or we can even provide to Robert to send out to the group our SINAR coverage study. So if you're interested in reading a little bit more about this, we have a report that you guys can check out. So some of the services offered, we want to talk a little bit about availability and ease of access for young people to gain access to alcohol and other drugs as well. So in this study, we found that 22% of stores that were surveyed offered a takeout option. So the takeout option was 209 stores. So that was heavily, available. Takeout was heavily available. A small but growing number of establishments are also starting to offer curbside to go, drive through, and delivery. We'll share some focus groups data later on from some college students that stated that obtaining alcohol from any of these types of services was much easier than traditional going into the store purchasing the alcohol. There was some key factors that they mentioned as being related to getting alcohol easier in these formats. And then, sorry, slides. And then here we want to talk a little bit about the data. And we see 46% of liquor or tobacco stores are accessible to youth. So we want to, see if they are, oops, I thought there was one more animation here. So we saw that they were accessible to youth, which means that they're near schools, parks, daycares, colleges in particular. Many stores were directly across from or within walking distance of youth facilities. So that doesn't just include those people 18 to 24, but any establishment where, young people might be engaging. When it comes to youth inaccessibility, most reasons the location was not accessible are due to age restrictions, like you cannot enter the store without being a specific age. There were also warning signs on the doors, like you have to be 21 or older to purchase products in this store, for example. Or if it was a bar or a liquor or tobacco store only, that normally did prohibit youth accessibility. Additionally, we also found that many smoke shops and liquor stores were within a half a mile of other types of facilities, such as dispensaries or libraries. Parks or recreation facilities was the third highest accessible. Colleges or universities was 2%. K through 12 schools and daycares was particularly accessible. And the reason I wanted to bring this up is because in total, 56% of these establishments were located around daycares, K through 12 schools, and recreational facilities, suggesting potentially social normalization during early developmental stages. So kind of, thinking about how we can work on public health strategies, maybe zoning policies, targeted interventions to really reduce that youth access or that perception of risk earlier on, so that when they are, very just in our environment, we're just continuously exposed to these types of stores and establishments, they kind of have like a better ability to set a boundary in their own life for their social or their health habits, right? Kind of promoting, some of these initiatives may also promote safer retail environments as well. I know, I've worked on like looking in my own neighborhood at like how many stores there are, and it's difficult to say, like there's so many in one small area. It can be really hard to find somewhere else to enjoy positive coping strategies. So like Maria was saying, the students feel like there's not a lot of engagement available on campus or off campus without alcohol being a factor. So here I just want to show in the study how common or not common it was to have alcohol age of sale signs. So definitely something we are working on with our establishments and helping increase those alcohol age of sale signs, making it very clear that you have to be this age 21 and older to purchase alcohol. And it was much less likely that we'll find those age of sale signs overall. But when they were present, they were more likely to be on the outside of the store, like on the window or maybe a door of the retail establishment. Instead of being on the inside and the outside, for example, they planted the seed on the outside. Maybe they'll still try to come into the establishment and purchase. So just the more likely we're, going to have those signs, it's going to be better, hopefully to prevent underage drinking, right? And then also of the retail establishments where patrons had to be 21 or older to enter, for example, like smoke shops, liquor stores, and bars, there were 136 total establishments where 62% were recorded as being accessible to youth. We are very, pretty very accessible to youth when it comes to liquor stores, bars, and the smoke shops. And I just mentioned smoke shops here because, again, those products can be in other forms. Those like THC products, kratom products can be in drinkable forms. Now I'm going to share some photos, but before we do that, I just want to share a required disclaimer. The following images feature products that are marketed to promote the consumption of alcohol and are presented for educational purposes only. Neither FATA, the Florida Behavioral Health Association, the Florida Department of Children and Families, Community Coalition Alliance, nor the University of North Florida endorses, recommends, or has any financial stake in the products shown. All images are courtesy of CCA. We took them through our environmental scan, signed our covered study during that study this past year in 2025. So just kind of wanted to go through all of these different products, kind of show you like what does the landscape look like. I'm sure you guys are very familiar. Everyone grocery shops, right? Most likely, unless you're doing like Uber delivery or Instacart and things like that. We are pretty much being exposed to this marketing environment, right? We see various names of products like Happy Mom, Mom Water, again, these things are not endorsed by us, but we're just showing you, like earlier when I was discussing Gen Z, kind of, targeting some different, groups of people, kind of changing their names even to like Sunny D and Dunkin'. Like these are very common things that young people are drinking, usually non-alcohol related, or maybe throwback Sunny D. We used to drink that as kids. Maybe they want to try the vodka version of that now. It's really common, and it's difficult to also perceive the difference between the spiked version and the non-spiked versions. They look very similar, so it's also potential for accidental exposure to alcohol products. We have seen where language can be a barrier to understanding that certain products are not juice and they're actually alcohol-based products. We also see pre-made things like these gelatin shots. Moving on to other photos, we're seeing fun colors. Mountain Dew is another one that's, recently decided to create a alcohol-based version of their drinks. Popularity of seltzers has also gone up in terms of trying to be healthier, right? I mentioned earlier that some of these other drug companies like kratom products, THC products are marketing them as being healthier, which they're most likely not shown to have evidence for that, and so, just also the other thing that we think about is a push on singles being, in these large bins. It's easy to take one and hide it in your pocket if you're not 21 and older. It's easier to, conceal this if you're trying to obtain it underage yourself. Hide it in your room if you don't want your parents to see, for example. It's easy to not have to like purchase multiple products to create a mixed drink. It's already pre-made. It's just easy to grab. And it's also usually in the front of the stores. So maybe even young people don't have to like travel to the alcohol aisle. Certain grocery stores have that alcohol aisle kind of pushed to the back of the store. It's not heavily promoted in certain grocery stores versus in other stores where those we see these like boxed bins right at the very front of the store, or even in the checkout aisle, by the candy even, or like by the cooler section. Even in some smoke shops where I went to do my own scanning, or even in some liquor stores where I did my own scanning, I saw alcohol in the same cooler as some of these kratom drinks, some of these THC drinks. So maybe even not even being aware that, like, if you're building your own six pack, for example, that you're mixing multiple products, multiple drugs together, you might like not understand the risk of two substances interacting in your body. So we have to understand, like, not mixing, alcohol with other drugs as well. So, this is just kind of like a quick engagement activity. If you want to type in the chat, you're more than welcome to, as like a quick activity. Which one is the one that is alcohol based? If you first looked at this slide, and maybe after a few minutes now you figured out which one is the alcohol one, but it's sometimes really difficult to see, especially if you're just like at the gas station maybe and you're trying to pick up something in this Florida heat we're not dealing with today or this weekend coming up, but definitely over the summer. Yeah, exactly. Hard iced tea. Exactly. And that is a key driver and that is key language. But even think about populations who don't have language accessibility. Maybe their English is not their first language potentially. So we have to also think, is hard a key language that everybody understands unanimously? Most likely not. Spiked and hard are two words that are not always common for understanding that this is an alcohol based product. Maybe young people do understand that, but older generations may not. Or, even just, children in your home, making sure that, we are safely storing alcohol, to make sure that, early on we're setting the social norms that alcohol is not supposed to be accessible to anybody under 21. And I see in the chat as well, important to know that soda brands such as Doritos are also making hard soda. Very interesting. Yeah, I did not know that. It's very common. So I'm glad that I'm learning something today as well. All these products are continuously evolving. It's really crazy to see the market. So that's kind of what we want to show you in these photos, is how quickly the market is shifting to for alcohol based consumers. Here even we see, iced coffee, right? We see spiked and iced coffee. They look really similar. We also see them, having pre-mixed espresso martinis, and all these different types of products are just, they're unlimited number of types of products, anything for anyone, which is just, it's too much. So really thinking about that promotion, even Crystal Light, that was something my grandmother drank back in the day. I drank it as a kid. Like, it's just so funny to see, like, wow, so much. Exactly. And buzz balls are really common. I'm seeing in the chat as well. There's these huge ones that you're seeing on the market as well. So just easier to obtain, more likely to share those drinks. Maybe somebody is 21 in college, they get it for other people. So you just got to think about that as well. Another big push is not only to transition to quote unquote healthier substance products, which of course they're not, right? But also avoiding that hangover. So being able to continuously binge drink without having the consequences, as Maria was discussing earlier. We have these hangover aids and all of these like bounce back type substances that who knows, they're all like kind of supplements as well. So again, supplements are not regulated by the Food and Drug Administration. So we really need to know that, make sure what you're using is safe and those types of products. So yeah, just kind of, promotion of other products in the same aisle as well. So and I know I've kind of mentioned, some of these other products being available. So, these are on the edge of legal. There are some policy changes happening at the national level to kind of control kratom in different products. Recently, there was a new policy change for something called 7-O or 7-hydroxymetragenine, which is a kratom product. typically found in like a powder, but potentially was going to be transitioned to drink as well. So just see some of these different products that we're seeing all across the market, and sometimes again the same coolers next to the alcohol. And people don't understand the body effect on these things. I'll just share one quick um, note to you guys. I know we're focused on alcohol today, but we know that alcohol is a depressant. We know that the effect in our body is going to be depressing our nervous system. We're going to be less reactive. We know that we're going to have less judgment. For other products like kratom, THC, it depends on the type of substance it is exactly. So, for example, kratom in your body acts both as a stimulant and a depressant. So, depending on the dosage, you are not sure exactly the, physiological interaction in your body. So, people have to kind of also understand, like, when you're purchasing these drinks, the impact on your body it can differ as well. So, we just kind of have to see, exactly what you're purchasing, how you're using it, and be very careful. Um, yeah, actually, I'm seeing in the chat as well, even the near beer brands have alcohol in them. I've seen some of those. I've also seen some of these like non-alcohol based um products as well that have like the same name. So it could also, kind of social norming. It's just kind of reinforcing that like you have to have something in your hand to engage in these social environments instead of changing some of our mindset to be able to set boundaries and be able to, be able to say no effectively, that, you're standing strong on your health habits and you don't have to feel that peer pressure. That can be really difficult. CCA is working on a youth initiative called the Facts Your Future. So that's something we're communicating in the program to help youth be able to set those boundaries. Oh, sorry, I meant to communicate about these as well. So just kind of another type of, THC quick drinks. We see these like we used to see these energy shots. I forgot what they're called. But I never used them, but like those 5 hour energy. We used to see those a lot in the gas stations, or maybe we still do. I just honestly don't look for them. But we're also seeing other types of quick energy. I'm seeing some stimulant ones where it's like, being able to quickly, get energy, but not like caffeine energy. Other types of stimulants are available, but also THC and other products. So I just wanted to, put in your mindset to also there's all these other things that college students are having to say no to as well, besides alcohol. It can be really tough, not only just to say no to alcohol, but also everything else. So I just want to share our focus group study that we conducted some focus groups on campus at UNF, on campus at a couple of other colleges. We also interface with lots of different interns throughout our various universities throughout the state of Florida. We, meet college students in outreach events, various ways of like meeting them. This is not a robust study. That's why I'm calling it college student anecdotes, because this is not like a randomized sample. It's a convenient sample of college students we met. So, take everything you're hearing here with a grain of salt. But we would love to continue to, share this survey out across our entire state so we can get a more robust sample of opinions. But just to kind of share what we heard from numerous college students, I did share some things earlier about, not being ID'd within those various types of like curbside to go, takeout, delivery apps and things like that. Again, I just want to mention that like this curbside to go delivery and takeout was actually a COVID related policy that the state of Florida implemented. It was, a very new thing during that period of time. It was, something so that the state of Florida could continue to have our, commerce continue during COVID. Our liquor stores were a essential business during that period of time, and convenience stores and all these different, types of stores were an essential business. And those policies actually stayed in place after COVID. So they were written into formal law after COVID, and things like that. So just kind of thinking like these are very new types of access methods for alcohol. We're, heavily transitioning to all of these Instacart and things like that, since, maybe 5, 6 years ago or so. Um, Students have, really not been traditionally ID'd as much or more effectively during those types of um, purchase points. And then also, they're more likely to be easier to use a fake ID, they mentioned, for takeout or curbside to go. They specifically mentioned that like the people are either not checking or it's just easier to not because it's kind of like a host usually bringing you the things, or maybe somebody from the kitchen potentially. It's not always like a bartender who's had like specific bartender policy trainings and things like that. So it's potentially a different staff person who's bringing those items to your car. So some of the contributing factors. Also, students have mentioned that their peers have had some fake IDs that actually do scan. So sometimes, like I know for DoorDash and Uber Eats, sometimes you actually have to scan that ID, and you're not able to, as like a DoorDasher, you're not able to like leave the items at the doorstep without actually scanning the ID. Sometimes that's like a you can't move forward in the app until you've done that. But even students know other students who've scanned a fake ID. So, just kind of thinking about that. Some students also wondered, if scanners may not be accessing the state database and are just kind of confirming whether the ID scans versus whether it's actually, you know, whether it's just kind of checking the state database. So is it actually communicating with that database? The students kind of just mentioned some anecdotal questions even in the survey, because it's kind of like the survey has like share more ideas, kind of like an open text box. And then, so sometimes they don't even have to have like, they have a legit barcode, but you don't have to actually check if like the name matches what that barcode is scanning per se. Also, in some of the students' experiences, restaurants do prompt whether they want to take the rest of their alcoholic beverages to go. So, this was like a new thing. You can eat in the restaurant, and then you can take the alcohol to go. There are some policies that state, that alcoholic beverage has to be not have a straw in it. For example, it has to be wrapped in a sealed container. There's other, it has to also, the restaurant has to be serving like 60% of food versus, their sales have to be a specific percentage of food versus alcohol. So it can't just be like solely a bar. It has to be like a bar restaurant type deal. I will say that our own agency at CCA did our own secret shopping, where we went out to restaurants, numerous restaurants that offered to go, and we found non-compliance across the board with this particular policy. Additionally, the policy states that when you take alcohol to go, it needs to be behind your third row of seats, or technically in the trunk. And I don't think anybody has cup holders in the trunk in any vehicle I've ever seen in existence. So, it's just a weird policy. Maybe potentially. So, just not able to be maybe even compliant if you do take alcohol to go. Yeah, just, I've even heard additionally, like people do know that people are drinking in the car as well when they take alcohol to go. A lot of the college students were not familiar with the specific policies around alcohol. They only kind of know the policies where they lived, sort of. They also don't have experience, they do have experience doing takeout from restaurants where they purchased an alcoholic beverage. So a lot of them did have that experience. So we reached people who kind of knew what was happening in the landscape. And then this is just some data to show, that nearly half of the students noted they knew somebody under 21 who was able to purchase alcohol. So that's a lot of students knowing other students who are purchasing underage, not having to go through the loops and hoop of having somebody overage purchase for them, and all of this that creates additional barriers, which we like to see, that preventing underage drinking, right? So just kind of noting that a big proportion of them are getting access to the alcohol. We're also seeing that 40% responded that they drank the to-go beverage in the car as a passenger. And then 1 in 4 respondents to the survey shared that they knew people who were actually driving and drinking when they took the beverage to go. So they're not keeping that beverage and waiting to drink it until they get home. So, accessing alcohol to go in the vehicle. I've even worked with some of our local law enforcement agencies, and they are very well trained on, identifying the signs of a DUI, not just for alcohol, also for those other drugs, right? And they are seeing even now, even so early on, that they see people with open containers of some of these other beverages like THC, kratom, kava, and not even realizing that those are an intoxicating beverage, something that you're not able to drink and drive. It's not like an energy drink or something like that. It's they're, they market it as a botanical tea, but it's not a tea. It's intoxicating, right? So just knowing the difference that that's not something you can drink and drive, we kind of understand unanimously that you can't drink alcohol and drive. It's like very, we've campaigned about that. We've raised awareness about that enough in our nation that that's a pretty common understanding. But we're still working on that in other spaces. So now I'll turn it over to Maria to chat more about social media and some other things about college age populations.
Thank you, Vanessa. Yes, so I want to talk a little bit about other ways that they're being influenced. So, aside from environmental factors, and what we've seen in the past few years with like to-go beverages, but I teach a course called Public Health Strategies at the university. And what I teach my students is how to really look at the different influencers of their audiences. So if they have a target audience, then that audience will also have secondary influencers and tertiary influencers who are either super close to them or a little further removed, but they're getting a lot of information from these people. I did see the question in the chat from Jean too. We don't have any specific data on mocktails, but this generation also does really drive that. And I think it goes back to kind of what Vanessa talked about in the SINAR data. And with the pictures, is that although they're switching to mocktails, a lot of times on social media and things, they're seeing like supplemental drinks that aren't alcohol, but they still have some effect on the system. So they could have kava or kratom in them, and students might not understand that. And so, although, yes, they're switching to mocktails without alcohol, a lot of what they're seeing on social media is, oh, buy this product that isn't FDA regulated, just like the mushroom coffee now, like, oh, don't drink coffee, drink ground mushrooms. But all of those things aren't regulated by the FDA because they're considered supplements. And so that's where that can kind of drive a lot of the issues we're seeing with students engaging in like substances other than alcohol as well. But when it comes to alcohol use, there is a lot of influencers still that they're seeing. So Gen Z and these 18 to 25 are definitely highly influenced by Instagram Reels, stories, TikToks, things like that. And people on there look like them, they talk like them, they have fun like them. But a lot of times, those influencers are being given products to show them so that they can sell that product to them, whether it's going on a trip somewhere to a restaurant or going and purchasing some like alcohol drink online. And so students are seeing that. And then, like we talked about previously, we also see those students who are posting the content as well, who go to that university. And then other students might see that and think, oh, I want to fit in. So seeing those friends drinking posts with likes and positive comments, and they're like, okay, well, I'm new here. I want to meet people. And then they can fall into that trap of that's what everybody's doing, even though we do see still that about 50% of students aren't frequently drinking on campus. So students also construct alcohol-centered identities. So if they're a partier and they only drink at parties, or maybe they're a social drinker and they only drink when they're going to meet friends, or sophisticated drinkers, maybe they're going to a dinner or something like that, but they can give themselves alcohol-centered identities. And that's another thing that's like a little bit different about Gen Z is that they're very focused on their identities and who they are and their branding because that's what they see influencers doing, as opposed to like in the millennial generation, we were like, don't label me. Like, I don't want to be labeled. But this generation does. And so they find ways to do that even with their drinking behaviors. We also see again, like those audiences, they're influenced by creating targeted ads. I always ask my students in the class, like, Have you ever had good information come from somebody and then all of a sudden at the end of the video they're like, "Oh, by the way, go to the link in my bio and purchase this." And then you know that that person may not be giving you the best information because they were just trying to sell a product the whole time. So we do see that social media branded content has higher odds of drinking and binge drinking among younger adults if it's being presented online to these students. And then also, just that if they feel now, if they post about drinking, so again, you have this next person who's influencing the new college students coming in, and then they receive that social validation, or as we always say, like they want that instant gratification. They want to like hear the good job right away. And so we see a lot of that too, like the comments and likes that they get from engaging in drinking behaviors as well. And so they can see all that. On social media with their friends. And then we also have to think about the general media. So these would be more of those tertiary influencers or the third, a little further removed. But movie stars, seeing in movies, they don't really portray the negative consequences of drinking. The college students are going to a party and they're having fun. And very rarely or very quickly do the negative consequences happen in these things, but it's not like this full on, this is what it's about. It'll often exaggerate how common and accepted it is, like, oh, this is just the college lifestyle. Everybody drinks, and that it's socially accepted on campus. And then also that repeated exposure of this, seeing it constantly in movies and TV shows and influencers starts to normalize and kind of shape those behaviors, which long term can lead to more social problems and things that come from that that aren't just, oh, going to a party or social drinking, but becoming like more integrated into their lifestyle. And then we also see that social drinking in college, so just in general, with friends, is that most of the time they're doing it in a social setting. So, with that transition and belonging piece, peer norms and expectations, what they're thinking, and then also those environmental and cultural factors, just to recap a little bit. And then games and sports are something we haven't fully touched on. We talked a little bit about the tailgating, but this is one of the places you're most likely going to see that social drinking happen, gearing up for a big game. We have in Florida, the Florida Georgia weekend, things like that. And so college students are out there, they're seeing that. Again, it creates those norms. We actually didn't have tailgating for a long time at our university, and they recently brought it back. So just again, making sure that as these things are being promoted, we have those correct policies, regulations, and safety nets in place. So students are able to be safe in those environments as well, especially when it's now being promoted again. So we're seeing like participation in or identification with college sports that are consistently linked to higher alcohol consumption. So sports days, and celebrations after sports. We'll also have our watch parties and then more event specific heavy drinking like those tailgates. And we're also starting to see more of e-sporting events too. So these are like video games, but if they do have access to the alcohol on campus, maybe they're drinking before. And then we also see those sponsorships from alcohol. So I was just in the cafe and I saw like a Coors Light little stand right there. So it's like it is being promoted. They are seeing it consistently. People are always coming to like give away energy drinks on campus. So those binge style cues are happening often where it's like, oh, this is just fun. It's totally accepted. Everybody's doing it type of thing. Again, even though we know that that's not the truth.
Right, and I just mentioned one quick thing. I just wanted to share that also in some of the like digital games like Roblox and some of these like other like different, I don't know, the gaming, right? The gaming world. The accessories are also substance related. I've seen some that are like alcohol accessories that you can purchase in your digital environment. I've even seen like inhalants that you can have as an accessory to your digital character. And I know that's like different from this a little, but I just kind of want to bring that up that it's so pervasive even in our like digital gaming world as well, like Nintendo World,
Yeah.
PS5, all these like, things.
Yeah, there are so many touch points. Thank you for mentioning that, that these students are being exposed to. So it doesn't matter, if they're a sports person or an esports or just like a typical gamer. We also see that branding happening there because that's how they're promoting products. Like most students use like Netflix or Amazon and things like that, and they can just pay not to have ads. So we like have to think like people still want to make their money, so they're going to find other ways to get that information and cues out to these college students in places where they are interacting. So a few physical and mental impacts based on this, and thinking about that, college students are drinking, 1 in 2 college students, a lot of them are binge drinking. So we do see that there are about 1,500 deaths per annually that are related to alcohol use among college students, about 700,000 assaults, so way higher than the deaths we see. And again, that's why we do like a lot of red zoning and things like that to make sure that students are aware of the other impacts that could come from drinking. About 14% have an alcohol use disorder. 1 in 5 college women experience sexual assault during their time in college. And then a majority of these sexual assaults do involve alcohol or other substances. So again, making sure to get the message out to students that although it seems like everybody's doing it and you can just have fun, you're on campus, it's safe, that's not always the truth. And so getting some of these real-time data and statistics, we talk a lot in public health about health belief model, and it goes over raising awareness of susceptibility and severity. So how likely are you to experience this? And then how severe could that be? And so as we are able to raise those points of awareness and change perceptions, we're better able to change those behaviors of our students as well. And then there are some academic related impacts to alcohol use. So we see that cognitive function impairment, especially if they were drinking the night before a big test or a night before they were supposed to be studying or giving a presentation. They might also experience sleep disruption and memory consolidation. Class attendance and engagement can be a little bit lower, especially if they're considered a partier or a social drinker. Again, if they're drinking the night before, they might not make it to class the next day, and thinking that college is a different landscape than work. College students live here, so they're able to just go to the bar on campus and have some drinks and then go back to their dorms. So again, we see those higher rates of binge drinking. And so it can really affect their class attendance and engagement in the classroom, as well as their time management and study habits. And then we saw that mental health interference earlier, where students in college do have more anxiety. They're likely to have suicidal thoughts. A lot of them have depression, and so adding alcohol use into that mix can really increase some of those risk factors we see related to their mental health. Some academic problems we see tied to alcohol use include that up to 33% of students report missing classes. So going back to what we see as consequences, about 1 in 3 do report missing classes. 1 in 4 report performing poorly academically due to alcohol use. And then about 25% of college students report alcohol-related academic problems, such as lower grades, missed classes, and falling behind. And like we'd mentioned, about 10% have heard from a fellow student, a friend, or a faculty member that somebody was concerned about their use as well. And so there are resources on campus. We have like the SOS system where we can actually put out an alert, and then those students would be contacted by the counseling center or, to help them. And so there are safety nets put in place there as well. But these are just overarching, what's happening when it comes to academic problems related to alcohol use specifically. We also see that heavy or frequent alcohol consumption is strongly linked to less time studying, increased class absenteeism, lower GPA. This is really hard because, again, these students are new to being independent. Oftentimes, they're leaving home for the first time, living in a dorm. And so now they want to fit in and they start socially drinking. Well, they're paying for their classes. Their financially depends on them showing up, passing the classes. And so, if alcohol use does interfere with that, it can lead to problems with that academic retention because students aren't able to focus on their studies. And these patterns contribute directly to students actually dropping out or delaying graduation. So, again, we want to catch it early enough to where we're able to help those students, get them to the counseling center, have them meeting with any supports that we have on campus. I know UNF has so many, so I could only imagine some of the bigger universities, and we'll talk about a few different things that they do. But there are so many supports, so we do not want this to happen. But because we know that there is a need and it does lead to higher rates of delaying graduation or dropping out, we're able to better get in front of those strategies because we can say we have to put funding towards this so that we can make that change for our students as well. And then just some statistics related to that. About 159,000 first-year college students drop out each year, with 28% or about 1 in 4 of those dropouts being alcohol related. Again, it's their first time out. They're probably just trying it for the first time and they don't realize what the real consequences and impacts of that are. Maybe they have a friend who got in trouble with it and they get scared and they want to go home. And so something like that could happen too, especially with our younger students when they start actually seeing some of those consequences and impacts among peers. It could bring up some of those feelings of anxiety. And then approximately 20% or 1 in 5 freshmen leave college predominantly because of alcohol misuse. And some students will leave a college because they see so many other students doing it. So some students want that more study-focused campuses. And if they end up going to what would be considered a party school that is more focused on that, then students will leave those schools to go to more academically focused campuses. So we do so see those differences happening as well. And then college student drinking and driving. So I did see there's some data was put in the chat from Van Cleef. So 30 to 40% of all traffic deaths in the US are alcohol related, and it absolutely translates into college drinking and driving as well. So about 600,000 students age 18 to 24 are unintentionally injured each year just under the influence of alcohol, but many of these involve transportation or driving incidents. The NIAAA that we talked about earlier also estimates that over 3.3 million college students, 18 to 24, have driven under the influence annually. And then the American College Health Student has about 7.4% of students reporting that they have drove in the past 30 days while drinking, after drinking alcohol. And an estimated 1,500 to 1,700 die each year from those unintentional injuries, including motor vehicle crashes. So it does translate back to our college students. And again, just that their brains aren't fully developed at that age, a lot of times between that 18 to 24, they're just getting independent. And this can lead to students dropping out of school again just because a friend has a problem and, ends up in like a traffic related incident or something like that. So it can raise a lot of concerns with our students who are just kind of experiencing the world for the first time on their own. This is some data from UF Frost, and this comes directly from the medical examiner report. But I just think that this is really great to look at when I teach freshman students about this in the personal and public health course. I like to show them that they do have that high incidence of decedents when it comes to alcohol use. So these are specific to alcohol use, and in 2024, about 49 cases were related directly to alcohol use, while 335 had alcohol use present. And so these are deaths related to alcohol use among those 18 to 25-year-olds.
Maria, can I just add one thing to that slide? I just want to mention
Yes.
that in the medical examiner data, alcohol is the number two leading cause of death in the state of Florida, only behind fentanyl, and it's only a few fewer deaths. So just to put that into perspective, alcohol is still a main driver of majority of deaths in our state. So just, kind of thinking about that, just wanted to put it into perspective. We know that fentanyl and opioid is very, very potent and very strong, but only like if I'm saying it off the top of my head, I think it was only 30 fewer deaths. I can verify it and let you guys know for
Mhm.
sure, but just wanted to mention that it's still a leading cause of death.
Yeah, typically what we're seeing is that it's very present. It's less the cause, but it's a lot more present when it
Yes,
comes
sorry.
to so yeah, where you see like fentanyl and cocaine still really high up there, but alcohol comes in the middle of those. And typically it's because again, they're being mixed and it's something that students are getting access to, maybe, not thinking while drinking out, things like that. And so yeah, we make sure to show that to our college students because a lot of times they think, oh, well, it's legal, so it's safe. And that's a big part of like the Facts Your Future too, is just because a prescription is legal does not mean it's safe. If it's not prescribed to you, you should not be using it. And it's the same thing with alcohol. Like you have to be careful. It doesn't matter if it's super accessible, just like tobacco is related to all of the leading causes of death in America that are chronically like heart disease, COPD. So yeah, it's really important to get that information out there because we like to think like, oh, it's so readily available, it's safe. So thank you, Vanessa, for bringing that point up as well. That's great. And then also I wanted to share this data from the medical examiner. So this kind of goes over a little bit about that too. So you can see that these are the count of deaths by drug type among those age 18 to 24. So, and again, this is causal and present. So when we're looking at 18 to 24-year-olds, the pink is what was present at the time of death, but it's not the actual cause. So again, although in the medical examiner, we do see that, it goes cannabinoids, ethanol, fentanyl. With cannabinoids and alcohol, it's typically present during death, but it's not the cause, as opposed to fentanyl and cocaine that are a lot more likely to be the cause of death in these situations. So, but always keeping that in mind is these are the things we most frequently will see students this age group being exposed to, especially when they're new to an area. Maybe they're in a red zone where there are those high rates of alcohol use, sexual assaults, and human trafficking that we see. So they are kind of going hand in hand here. So always keeping those things in mind as well. All right, and I'll turn this part back over to Vanessa to talk with you guys about some community prevention efforts.
Awesome. Great job, Maria. So next, I just want to chat with you guys about some of the Florida Department of Transportation's initiatives that are happening boots on the ground. I did see in the chat mention of mocktails as well. I know I just want to mention to you guys that Florida Department of Transportation provides free educational materials for the state of Florida to request on, prevention of drinking and driving. And recently they did put out, I think it was 2024 and 2025, they put out a mocktails recipe like book. It was so cute. It was like just kind of, I saw in the chat like mocktails are becoming more popular. I think that's definitely like an alternative to being able to socialize in that environment without consuming alcohol. But then again, we just have to be careful to make sure it doesn't have anything else in it. But I thought that was really like cool that Department of Transportation has those available for anybody in the state of Florida, to request them at no cost. So just a quick tip. The Florida Department of Transportation does a drive over get pulled over campaign. I believe this is a national campaign. In Florida, we evaluate this campaign at the University of North Florida's Public Opinion Research Lab. They give out a survey to assess the awareness of this campaign. And so just wanted to show you, like on this slide, it shows the percentage of survey respondents by age group who were reported having driven within 2 hours of drinking between 2016 and 2024. So this is, many years over time. But we can see that, 18 to 24-year-olds, although they don't have the highest reports of drinking and driving, there are many contributing factors that we mentioned today, some of them being potentially, living on campus, which maybe they're living in areas that are pretty walkable. They are maybe younger with access to technology, potentially where they're using Uber or Lyft versus driving. It's also very important that we continue to communicate the importance of alcohol safety among college students to make sure that they increase their risk perception, right? As they age, especially, their brain is still developing till approximately age 26. So being able to instill some of those values into their lives for alcohol safety, especially that we see those 18 to 34s are accounting for the highest number of people drinking and driving. So just kind of keeping in mind, they're that non-traditional college student. We're getting into that age. So, yeah, I just wanted to show you some of this data. And this is still that data. This is a little bit different. This chart is only from 2024's survey report, and it is assessing 2023's awareness campaign effectiveness, just to kind of put it into perspective for you guys, because the question is asking in the past year, have you read, seen, or heard anything about the Drive Sober or Get Pulled Over campaign? And they did this survey in the beginning of 2024, around March in April of 2024. So here we're seeing that, there's still some work to do with spreading the awareness message, right? Especially among these young adults. So even though, they're not the highest awareness group, they have around 58 individuals who said yes to that, that they had seen or heard anything about this campaign. And then this survey is also broken down by regional area. So I recommend kind of just Googling UNF Public Opinion Research Lab. You can even put in the Google search FDOT and reading this report, because it is broken down by your metro area. So wherever you are at in the state, they've collected data on your particular area. For example, where I'm at is in Jacksonville, and they collect it at like the Jacksonville metro area, which includes like 3 to 4 counties in my surrounding area. So it's kind of like a better representation of some of this data for your particular region. And then this slide is just showing, where people were drinking most at their most recent occasion, where they drove within 2 hours of drinking alcoholic beverages. We are seeing that 24% of people drove after drinking at a bar, tavern, or club, and 37% of people said that they were at a restaurant, totaling 61%. This is particularly important because while there's no explicit law in Florida that states like bars have to hold your keys or your, that is like a common practice across our state. I have heard from the Northeast Florida Safety Council on, some of the practices that, there are DUI educators after people have received a DUI. And they say that, that's an uncommon thing that people are not aware about. Like if people ask the bar, restaurant, or, tavern, club to hold their keys for that night, and, their car will be in the parking lot, it's kind of like a common understanding that this is an allowable practice. You just kind of have to talk to the bar about it and make sure that they usually will put like a note on your car at night. Although I will say in Tampa, there is a very direct statute. It's a local ordinance in Tampa area, pretty new law forbidding towing companies from removing vehicles from bar parking lots between 9 p.m. and noon the next day. In case any local area in the state is looking to do some advocacy, that's a potential policy to look to as an example. This is definitely going to, towing protection ordinance definitely is going to prevent drinking and driving, and, encourage people to call a Lyft, call a ride, have a DD, and other things, right? So, there's also other prevention measures in the state, specifically to, removing that fear, for example. There's also, laws in the state of Florida where, if you're in your vehicle, if the keys are accessible, of course, even if you're just sleeping in the passenger seat, you have access to the vehicle, just knowing the law that, there's a law called actual physical control of a vehicle, that if you're inside of it and you're intoxicated, it can lead to a DUI. So leaving the keys with a bartender, helps to avoid pitfalls of this, and because then you're not in control of the vehicle. And there's also there's like bartender policies if people have gone to bartender school and things like that, where although there's no state mandated laws, many bars will take the keys, or have a valet ticket system, call a ride share for that person who's a patron of the business, who is intoxicated. So just kind of sharing a little bit about some of the things that can potentially help, with when people are actually, drinking at another place and potentially considering driving. Um, Even though that's not like our primary age group for this, for our 18 to 24 year olds that we're focused on for this webinar. You never know, maybe off campus potential, students are off campus potentially as well. We have a lot of smaller state universities, like smaller community colleges as well, in the state of Florida. So just wanted to bring up some of those. And then I'm really excited to share this with all of you. This is an amazing initiative, called Credible Mind, that Community Coalition Alliance launched in August of 2024. Um, Credible Mind is a free evidence-based holistic mental wellness platform. Within the platform, there's over 200 topics that are related to well-being and, help people cope with life stressors, but also helps them gain those positive coping strategies to help reduce, potentially using a substance to cope with any, mental stressor. It has many different tools within the platform. It curates all evidence-based information. Everything in the platform has been vetted by scientists, subject matter experts, to ensure that it is going to lead to a positive mental health effect. So you're going to actually feel better, right? Versus maybe something you might search for on Google or ChatGPT, or another AI-based system that isn't fully credibly sourced. This takes out all the guesswork, and it's completely free to our users in the state. It also has a variety of learning formats for everybody who learns in different ways or wants to absorb information in a variety of ways, such as reading articles or books, but also listening to podcasts or watching videos. All of the things in here are trustworthy to ensure they've been vetted. One of my favorite parts of this platform is the assessments section of the platform. And I'll get into a little demo today, a short demo of the platform, just so you guys, feel comfortable sharing it out, feel comfortable using the platform for yourselves. A lot of us in this webinar are also helping clients, right? We're here to learn so we can help our clients a little bit better. So this is a resource for your community partners, a resource for your clients that you serve. But my favorite part of this platform is probably the assessments, because sometimes you just don't know where to start on your mental wellness journey. And this platform has clinically validated assessments that are based on, things like the PHQ-9, for example, as is a very common mental health assessment we're using in our state. So going in there takes about 2 to 3 minutes to take any of the assessments, and then it curates very tailored resources for your own mental health. So I think it's, not only is it holistic, it's tailored for you. It's completely anonymous. We don't, get any data on Vanessa took this assessment and Vanessa's results are this. We only see for our entire subset of users, we see how many people might be ranking high, low to moderate, severe symptoms of, say, depression, anxiety, and things like that. Everything that you do in the platform is completely anonymous. We want to make sure that this, we want people to get access to mental wellness information sooner. I mentioned earlier, the data shows that there's often an 8 to 11 year delay between onset of mental health symptoms and receiving adequate treatment. In that meantime, people are using negative coping strategies, unfortunately, but we're trying to intervene sooner. So this platform is going to help you on your wellness journey. It can even be used as a professional tool. I know we're all probably, communicating and educating our communities on all of the topics you're learning about today and many more. So if you're looking for, YouTube videos, articles, journals to share out professionally, I use this personally to go there, and I know everything's been vetted. You don't have to go on YouTube, watch the entire video and wonder, is it for sure evidence-based? if you go to Credible Mind and you're looking for a particular topic educational area, you'll be able to use those resources to share out in your community as well. Um, so this is the homepage. I just want to make sure that you guys feel comfortable share, seeing what it looks like. Make sure you guys get to the right page when you're looking for our website. The website is ccafl.crediblemine.com. Again, this is completely free. It's not an app-based software, but there is a really cool way of adding it to your phone as an app. You can just click the Android, iPhone users, sometimes the share button, if you click share that website in the browser, you can click add to home screen. So that's a cool way of using this like an app. Even though it's not something you'll purchase in the App Store, it doesn't have any paywalls like traditional apps would. Although Credible Mind will suggest evidence-based apps that might be useful to you that may have some paywalls. I'm sure you guys are very familiar with how the app stores work. Some things are free, some things require a little, a small fee. But Credible Mind does not, so check it out. So this is the homepage. You can search, you can sign up. On the left-hand corner, it is a little bit small, but you can see where it says English. I just want to let you guys know that this platform is also available in additional languages such as Spanish, Haitian Creole, Tagalog, which is a Filipino language, and Arabic. So we're, continuously trying to expand this to be more relevant to the community, have, culturally appropriate information. I really love this platform because you can also enter your own demographics and filter the resources that are provided for, say, if you're a parent and you only want information and articles and podcasts and journals about that are geared towards parents. We also have a youth landing page that I'll show you in a little bit, and everything in there is geared towards youth. So just some particular ways that you can engage in the platform. You can also, there's like little filters for Hispanic voices, Black voices. If you are identifying in these different populations, there's others as well. But if you only want information from experts that identify in this culture, that's also an option, right? Again, this is a menu of services. We don't want to have one size fits all mental wellness resources. We want to have tailored approach, holistic approach. So that's really what Credible Mind helps CCA accomplish. And then this is the topics page in Credible Mind. I'm only going to share, I'm going to talk to you as fast as I can chat with you, but I want you guys to really go to the platform and look through the 200 plus topics that are in here. There are things ranging from anxiety, stress, burnout, workplace burnout. Again, also there's self-care, there is meditation, parenting, online therapy, there's trauma, there's grief and loss, PTSD, there's caregiving and nutrition and job transitions and yoga and what else? Financial wellness. There is also coping with a new diagnosis, incarceration and reentry, overcoming stigma, forgiveness. I'm just talking as fast as I can chat, but kindness and moods and emotions, divorce, things that everybody may experience in their lifetime, right? Like different topics that really reach a wide range of audiences. And so we just want to let you know that like this is so robust. They're continuously adding new topics to the platform. When you select a topic, there's also subtopics within every other topic. This is very data driven as well. So it's going to normalize that you're not alone in what you're experiencing. It's going to show data at the national level that is reinforcing that, this many people are experiencing this worldwide, nationwide. So just kind of, you're not alone. There's a menu of services and it's credible. You can trust us, right? So again, this is my favorite part of the platform, the assessments. All of the assessments, there's about 15 different assessments. All of them are very short, minus our most robust assessment, which is the What's Your Mental Health Profile assessment, which takes about 12 minutes to take the entire assessment. The others are 2 to 3 minutes, very quick, focused assessments. That one is very robust. It covers social emotional well-being and also a variety of other topics, like includes social media use, caregiving, gambling. I mentioned in the chat, which we'll answer that question in a little bit, but other topics that are very relevant to our world and what people are experiencing. So here the assessments include things for loneliness, attachment style, depression, anxiety, PTSD, trauma, meditation and procrastination and substance use as well, and sorry, what else was I going to say? There's a variety of different mental health check-ins as well. So a few different types of mental health assessments. So in case you really want to get into different areas. So there's, always new ones being added during the holiday season as well. There's a holiday stressors assessment. We just passed the holidays, but I'm sure we all felt a bit of stress during that time to just kind of assess and, see how to help. I'll give a really quick anecdotal story. But when you take the assessment, it's going to, link you directly to very specific resources. I took the social support assessment and it really dug deep into my social support, that I had and helped me get resources for very specific areas of my social support. And then this is one of the areas of the platform that we have at CCA worked tirelessly to make sure that we're aware of resources across the state of Florida to make sure that when people are coming to our site, they're not only linked with credible educational information, but also a local resource that directly relates to the challenge that they're having. Credible local resources, things that we've known about, things that our coalition partners are partnering with, our stakeholders and boots on the ground, local services, right? So if you are a local agency that's not in the platform, I'll share with you next a survey where you can get added. It has like a little filters box where you can type in your location, the type of social service you're looking for, different types of, people they're reaching, if you're like women's health services or men's health services, the dental services you might be looking for. You can read more. You can take the next step to visit the individual's website. And then I will also share, I think maybe, let me double check. I think this video also takes you to the top right-hand corner of your page. You're going to see, I'll click in a moment, the Need Help Now page. So right here, there's a little red pill button at the top, which is all of our crisis hotlines for the nation and for Florida. So if people are in crisis right now, there are crisis hotlines that are available to help support them. And I'm loving that, excitement. This is definitely something I'm excited to share with you guys today. I know all of you are representing agencies that are amazing throughout our state. If you scan this QR code, it'll take you to a SurveyMonkey link that helps CCA be able to gather your organizational information to help increase our resource database. And I'll just let you guys know as well, we were just recognized in the nation as being as an honorable mention for our platform, for the way we've been communicating this platform out to our state. We're having a webinar next week on that, but we also got recognized for having the most robust number of resources for our platform. We have over 350 resources. So just super excited to share with you that. Since 2024, we've had over 18,000 users to the platform. A majority of those users, 27% of people have shared their demographic information with us. And of that 27%, around a quarter of them are young people under 18. So we're very excited that, we're reaching people early on in their mental health journey. We've done that through tailoring marketing materials for particular populations. I don't know what happened there. But we have tailored those marketing materials. So we have one for students and teachers. We've also created others for like construction companies, women's clinics, all kinds of things. Like with first responders, we have a initiative going on with our fire rescue, with our sheriff's offices and things like that, with our chaplains and our, churches, with our, pastors and things like that. We have so many different partners that we've really communicated this out to. So if you guys are looking for tailored educational information, reach out to us. And then these are resources for, other things that you can help with, helping college students who are using alcohol. So just kind of want to put it back to our topic area for today. Of course, Credible Mind will help our college age students, but we've wanted to make sure to tailor a list of resources that are additional information. So you'll be able to click these links in the PowerPoint. And now I'll turn it over to Maria to close us out on campus.
Hey, thank you, Vanessa. So I just want to touch base on that too, because I think I'm just going to give an overview of this. I'm not going to go through the slides on it, But with Credible Mind, if you're looking for an in to giving information to college students, remembering that there are a few universities and colleges across the state, and students are traveling from multiple counties to go to those. And so, with a resource like Credible Mind, you could actually bring flyers to the college campuses and do engagement that way because it is available to those students as well. So, any students across the state. But again, I'm just briefly going to touch base on this. So, with campus prevention, we're really focused on making sure that students are aware of the resources, that you all are aware of who you can connect with if you're interested in supporting this population. So, on our campus, Dean of Students is very active. We also have Student Health Services who does assessments. Recreation and wellness is another great touch point if you're trying to get into a campus, and also the counseling centers. So these are great first starting people that you can connect with and reach out to bring resources to college campuses. Because again, the counseling centers are overwhelmed. We have so many students consistently coming to Florida, and it can make it really hard when it comes to that prevention as we're trying to reach such a large student population in Florida. So I will go ahead and skip ahead here. And so one thing I do want to mention is there are a lot of collegiate recovery resources popping up. So FSU, UF, UCF, FAU, and FIU all have their own collegiate recovery. UNF, we're just getting started on one called CLEAR. It's the Collegiate Leadership, Empowerment, and Advocacy for Recovery on college campuses. So we're going to be doing a pretty widespread survey here, getting some information from students. But there are collegiate recovery resources available at multiple colleges. And we also see that most colleges, when students come in, require students to take an alcohol training so that they learn about the negative risks and consequences as well, just as they come in as freshman students with their orientation. So that is really great to see. And then I'm just going to skip ahead. Um, Sorry, to this slide here. So there was a good news article that came out December 2025. So the really nice thing we're seeing is most college students, so about 30%, are abstaining from alcohol use during college. That's the majority behavior. The college effect on drinking is starting to reverse. And younger students are leading that shift towards non-drinking. So as we talked about mocktails, but again, educating students on other things that might be in the drinks being promoted to them. But the nice thing is that we do see students are starting to refrain from drinking. So the more activities that we can have on campuses, the more resources, the better we're going to continue to see these outcomes. And that is the end of our presentation. So we'd love to open it up for Q&A for everybody here. And
Maria, Vanessa, I do want to ask one question I saw in the chat earlier. I don't know if you guys have any information about this, but somebody mentioned, and forgive me, I'm not going to remember the exact wording, but talked about alcohol use in betting environments. I know that
yes.
betting, and especially on sports, is a huge thing now. You see it advertised all the time in commercial breaks. Do you have any information on the correlation between that betting environment and alcohol?
So we don't have the data, but I will say that I know it is college situational too. So there are like obviously fantasy football teams that college students will start, and then on the game. So it depends, does that college or university have a sports team? And then also with that integration of esports, we might also be seeing that happen here. So as drinking is integrated with sports and esports, um, yes, we definitely see that there is some correlation happening there, but I'm not sure if there's very specific data on that.
Quickly did like a little research while you were presenting, Maria, like in while I saw that chat, and I saw like there's some data showing potentially 10% of men age 18 to 30 are showing signs of a gambling problem. And I just want to mention that like the pathway in our brain for addiction is going to be following the pathway for gambling to substances to whatever it might be that we're addicted to, right? So just kind of reminding ourselves that that is the same pathway in our brain. And also that sports betting is, like Maria said, it's so pervasive. It's all on our phones. It's 24/7. It's these micro betting as well, and it's the social environment. So, I've seen that like it's sometimes the bond happens more about the bet versus the actual game that they're betting on, right? So like it's also just like, some being reinforced in many different environments. So kind of thinking about it that way. There's a gambling topic, Incredible Mind as well. So if you guys want to read more about that. Any other questions?
I haven't seen any, so I'm gonna take it to the conclusion, but we'll put up, oops, excuse me.
And I think the slides will be available. So I know we skipped a few for sake of time, but those will be available. So the slides on the rest of the campus prevention are available. Thanks, Robert.
Yes, absolutely.
Thank
Thank
you.
you, Maria and Vanessa. Their emails are here on the screen. So if you think of any questions that we didn't get to, or if we missed something in the chat, please feel free to email them, or you can email us and we'll make sure that question gets over to them. But I want to thank you both for the time that you shared with us today and the wonderful information. Everyone hold for just a moment for some conclusion business items. The evaluation will automatically populate when I end the webinar here in just a moment. You will also receive an email with the evaluation link in 24 hours. As a reminder, the evaluation is open until Tuesday, February 3rd, 2025. If you have any questions, you can email us at training@floridabha.org. Certificates will be emailed to the email address you used to register for today's webinar within 30 business days. If you request CEUs, they will also be reported to CE Broker within that same time frame. As a reminder, you must have attended the entire webinar and completed the evaluation. We are not permitted to provide partial credit. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording in PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. Thank you everyone for participating in today's webinar. Thank you again, Vanessa and Maria, for your time. We'd also like to recognize and thank the Florida Department of Children and Families for funding today's education. Have a great day, everyone, and please hold for the evaluation.